Hello and welcome to First Academy's OET Speaking Mock Test. In today's video, we are going to be looking at one kind of mock test that most Indian students have trouble handling. The one about sensitive topics. This video is going to talk about a patient who's just undergone a right breast mastectomy. This video is in two parts. The first part will be the actual mock test, followed by the examiner's comments on the candidate's performance. So let's dive right in.
So as part of the test, we'll be doing a warm-up conversation for about 2 minutes, and following that, we'll be doing a role play. The warm-up conversation is introduced so that we can get used to each other's voices and make you feel a little comfortable and relaxed while doing the role play. Is that clear?
Okay, yeah.
Do you have any questions?
Not yet.
Good morning.
Good morning.
I'm Bharti.
Hi, I'm Divya.
Yeah, welcome.
Thank you.
Yeah. Can I have your full name and your profession, please?
I'm Divya Kurukuti and I'm a nurse.
So are you currently working or are you a student?
I've taken a break from my work, but I finished my studies very recently.
Okay, fine. So what are your future plans then?
I want to study or work in another country.
So what's your choice of destination then?
The UK is my choice of destination. That's where I would want to go.
Is there any specific reason for moving to UK?
Well, I've heard the NHS system is very fair, both for rich and poor, and everybody comes there. And there is a lot of demand for nurses. So that's where I want to go.
Are you aware of the prerequisites if you have to satisfy the criteria to work in the UK?
Well, I was told that you have to write an English exam, OET, let's say. Also finish a CBT and an OSCE test, which tests my knowledge on nursing.
But why particularly OET then?
Well, I felt OET is very close to my profession and it's all based on medicine, not on a generic topic. So I selected OET.
Okay, fine. Do you have a short-term goal or a long-term goal?
Well, it's a pretty short-term goal. It's a 2-year long goal. I would want to work somewhere for 2 years, gain some experience there and maybe come back to India, but I haven't yet decided.
Okay, fine. So why did you choose to become a nurse?
I think I didn't have a choice. I didn't do so very well in my NEET and I didn't get a good rank, but I wanted to be in the medical profession, so I became a nurse.
Okay, fine. So what do you think are the challenges when you deal with patients sometimes?
Well, I feel the biggest challenge is that a patient feels that a nurse's knowledge is inadequate and they don't respect us as much as they would do to a doctor, but we're also there with the same purpose of helping them and serving them, and I think that's not realized.
Yeah, so true. Yeah. If there's one thing which you would like to change with regard to your profession, what would that be?
Well, I think nurses should be given respect. They should also be paid well, and they form an essential part of the healthcare system, and everybody should be aware and realize and even appreciate, if possible, the work that we do.
Okay, fine. So that's good. Thank you. We'll be doing the role play now. I'll be taking the role of a patient or a relative of the patient, and you'll be the healthcare professional. I'll give you a role play card which has the content necessary for you to do the role play, and you must demonstrate your ability to communicate effectively with your patient. So that's the purpose of introducing the role play. Are you clear about this?
Yes.
So I'll also give you a paper and a pen so you can make some notes and seek any clarification if required.
Oh.
Is that all right?
Yes.
Yeah. So here is your role play card.
Thank you.
And a paper and a pen for you to make some notes.
Thank you.
So your time starts now.
Good morning, ma'am. How are you feeling today? I see that you are a little distressed. What is bothering you?
Yeah, good morning, sister. Yeah, of course, I'm feeling a little low, and I also feel I'm looking a little ugly without the breast after I've undergone the breast surgery, So I'm really not sure how I will be able to cope with my ugly looks.
I understand how you are feeling. It's very natural to feel like this at this point, but I'm sure it'll get better with time. And see, fortunately, you have such a loving family, a husband, 2 kids. Over a period of time, you'll totally forget about this.
Okay, but I know that it might take some time. But at the moment, I'm feeling very low, and I really don't know how I can improve my looks, So I just want to seek some suggestion or advice if possible, if you can give me so that I can improve on my looks and feel a little better?
A quick option would be to wear a padded bra, stand in front of the mirror, look at yourself, and normalize the look so that you can accept it and feel good about it. A radical approach would be to get an implant, but I feel that's a little expensive.
You mean a surgery?
Yeah, I mean a surgery. And all surgeries come with a little bit of risk. There could be complications. So not right now, but once you fully recover, you can think about this option.
Oh, okay. So you mean to say it would help me with improving my looks then?
Certainly, you won't even able to see the scar anymore, and they would recreate everything. It will seem like a natural breast.
Okay. So apart from the options that you have provided, is there anything else that I could do post-discharge, so that I can feel a little more confident? Because I feel I might be looked down upon, and I lack confidence basically.
Well, the first thing for us to understand is that given the clothing options that we have, nobody else would know that you've undergone a surgery and your right breast has been removed. It will seem to others, to outsiders, it will seem as normal. So for you to feel a little more confident, you should start feeling like yourself. And because of the incision, because of the stitches, you might feel a little uncomfortable initially.
Yes.
But if you can do a few stretches, and once it all heals, it'll all seem natural, and you can also get back to your work and your regular routine.
Okay.
You could also do a few post-recovery exercises to feel comfortable, like stretching your hands or doing a few shoulder stretches. But be very gentle. And if you feel that there is any kind of pain near the incision site, I want you to relax and take some time off. And only when the pain subsides, you can later resume your exercise. Initially, there is always we're always worried and the risk of your incisions tearing apart. So make sure you don't carry something heavy, don't exercise with dumbbells. Remember, be gentle and love your body.
Okay. So what would be the most ideal time I could start or begin with all these?
Well, for the first 1 week, I would suggest that you rest. And after the first 1 week, when you feel that a little bit of swelling has gone down, we can start this exercises very gently. If you're worried that you can't do it all by yourself, maybe taking a help of a physiotherapist would also help us.
But one more thing, sister, that's really bothering me is I'm feeling a little guilty, about going through all these. So how will I be able to cope psychologically?
Well, first thing first, it's not your fault. Please remember that. At this point, I think everyone who goes through such kind of an operation which affects their looks feels this way. And over a period of time, this feeling will also subside. And you have to lean on your family for any kind of support or help. Right? And also, it might give you confidence if you are open about it and not hiding it from anyone. Of course, we're not going to go tell the strangers.
Yeah.
But remember one thing, that unless you tell them, they wouldn't know.
Okay.
So make sure that you wear the right kind of clothes, and so that nobody knows, and you can be confident about yourself.
Yes. Okay. Yes. Okay. Fine. So, of course, I have a very supportive husband and my 2 sons. They're quite supportive. In spite of that, this thing is really bothering me,
I totally understand how you're feeling now, and you'll have to trust me that I've seen a lot of patients go through this, and they feel they get really very comfortable with it over a period of time. But we have to go through that period where you totally recover and feel yourself. So please give it some time. If later also we have any problems, then we could take some kind of medical help to, if really is affecting your mental health, then we can work towards making it better.
Yeah, that sounds good, sister. Yeah.
Okay, take care of yourself.
Yeah, thank you so much, sister.
Now, you've heard the candidate speak. What do you think about her performance? What score would she receive? Let's look at the analysis. Let's first start with the positives. The candidate has performed excellently in the range of linguistic skills. Her grammar, her intelligibility, appropriateness of language, and fluency were all fantastic. So, where did she falter? let's dive in. The area that she needs to focus on is improving the clinical communications, in which the first part would be to address the patient by name. Whenever we are talking to someone, whether it is in real life or in a medical scenario, the best way to establish rapport is to address the person by name, which this candidate has failed to do.
Good morning, ma'am. How are you feeling today? I see that you're a little distressed. What is bothering you?
And this can be a huge negative when it comes to how your OET speaking is evaluated. The candidate follows up well by asking the patient an open-ended question about how the patient feels. Then the patient responds.
Good morning, ma'am. How are you feeling today? I see that you're a little distressed. What is bothering you?
Yeah, good morning, sister. Of course, I'm feeling a little low, and I also feel I'm looking a little ugly without the breast after I've undergone the breast surgery,
However, once the patient has responded, the candidate fails to summarize the patient's response and then also fails to ask a follow-up question to check if the patient had any other concerns to be dealt with.
I understand how you are feeling. It's very natural to feel like this at this point.
And this can also affect your score. Since this is a medical conversation where a lot of information is being exchanged, it is very, very important for any speaker, especially a medical professional, to observe two rules. One is chunking and the other one is checking. What do they mean? Let's start with chunking. When you're presenting patients with a lot of information, it might be that they find it very difficult to assimilate all that you're presenting to them. So you must present the information in chunks. Now, once an information has been presented, then comes the next part, which is checking. You must check with the patient to see if the patient has understood the information that has been presented by you. And if this is missing, we might not really be aware if the patient has fully comprehended what you're trying to convey. So, how do we ensure patient understanding? One easy way to do that is the teach-back method. What is the teach-back method? As the name suggests, once you give patient the information that they need to process and understand, you ask the patient to repeat the same information back to you in their own words. Another thing the candidate has missed doing is summarization. Before winding up any OET speaking role play, it is always best to summarize the discussion that has happened between you and the patient. This will allow both you and the patient to see if any important information has been missed or misunderstood. This summarization should be followed by what we call a deliberate question, wherein you ask the patient if there is anything else the patient would like to be addressed. Another area that the candidate fails to impress in is while playing the role of an active listener. So how to be an active listener? When we present someone with some information, we expect some form of an acknowledgement from them. In the same way, when a patient presents you with some information, it is very important that you acknowledge that information. And this acknowledgement cannot just be in terms of body language. It should be some form of verbal response. It could be as simple as saying or could be asking a question, or simply sympathizing with the patient, saying things like, I understand, okay, that's all right, or that's so sad. So please remember, being an active listener is a very, very important part of being a medical professional. And this is something that the OET speaking test also takes into account. Now, are these the only areas where the candidate has faltered in? No, there are more, but these are the most important ones. We hope you really like this video. We worked hard in preparing this video to make sure that it gives you the best possible results. And if you want something like this, if you want your speaking to be evaluated at the same level as this speaking test has been done, you're all welcome to contact us at First Academy. If you really like this video, we'd love for you to subscribe to our channel, and not just that, we'd love for you to share it with your friends and anyone who's preparing for the OET. So, see you again in the next one.